Go.
Hey guys, it's Dr. Denny from Four Paws at Fulshire Veterinary Clinic, and we're going to talk about everything you need to know about your cat's surgery.
Dr. Denny, what questions should I ask my veterinarian about my cat's surgery?
How long is the surgery expected to last? What day? When is drop-up time? How do we decide when to pick up? How much is it going to be? That's a good one, right? We don't want any sticker shock, so please ask for a treatment plan so you know where we're going to be at. If there's anything additional that you want done while your cat is under anesthesia, please make sure to communicate that to the technician checking you in the morning. Pay attention to your phone. When you know that your cat is about to have surgery, keep your phone with you. I think that is my biggest pet peeve. We send a lot of communication for our owners. So our owners get a text when the patient's been given their pre-meds, usually when they're in prep, and then again when they're moving into surgery, and again when they're in recovery, and they get a phone call and a text and a picture when their pet is awake. So keep your phone with you. I think the hardest part, or the hardest, most frustrating thing for me is if something happens during under anesthesia, or we find something unexpected, or we have to do something that we weren't planning on. I need to let you know. And if you don't have your phone with you, I can't just keep your cat under anesthesia indefinitely. I do give about a 15-minute grace period. And if I don't hear back, then we move on and I don't do whatever I thought we needed to do because I can't do that without permission.
Will my cat go under anesthesia during surgery?
Yes. Yeah, we're not gonna be doing stuff awake. Ouch. Like no. Like, I don't know about you, but I don't want to be getting surgerized awake. For me, that's a big fat negative. And unfortunately we don't do as much with local blocks and pets because you can't tell them to hold still. So when I had to have a little mole removed at my dermatologist's office, no, they didn't put me under anesthesia. She numbed me with some lidocaine, and I held very still while she zipped it off for biopsy. I can't ask a cat, hey, I'm gonna numb you, and can you hold really still while I have a scalpel near your skin? No, they don't understand that. And so they do have to go under anesthesia. I think I get questioned all the time, well, can't you just do a local? And I'm like, well, if you can explain to your dog that we need him or her to hold perfectly still while we do this, sure. But I think you and I both know that that's not realistic. So they do have to go under anesthesia.
Will my cat be intubated for surgery?
I like to intubate everything. So what does intubation mean? Okay. Intubation means that we place a breathing tube down their trachea and inflate a cuff to make sure that, number one, we protect their airway. Number two, that if they do regurgitate or vomit, or if we're doing a dental with water spraying, that nothing gets down into their lungs. We're protecting those lungs, okay? So I like to intubate pretty much almost anything. Occasionally, if it's going to be an extremely short procedure, like lancing an abscess, I may just have them on some flow by oxygen if the patient's not completely on general anesthesia, if they're just on injectable sedation. But for the most part, even our cat neuters get intubated because the risk of anesthesia is low. I cannot say that enough. It is super low. And sometimes things can happen. And if something does happen, if someone stops breathing, if the heart stops, I want to make sure that I have control of that airway. So if I am having to administer CPR, I know that I am getting oxygen directly into the lungs. So that's super important. So I like to intubate everything.
How will my veterinarian communicate with me after my cat's surgery?
Well, we communicate a lot. I just think I just told you guys how much we might over communicate. And honestly, I think the reason why we do so much communication is I put myself in my owner's shoes, and I am a nervous Nelly. When it is my pets that have to go under, I need a lot of hand holding. And so I treat my clients the way I would want to be treated, which means you get a lot of text messages, phone calls. We generally don't do emails. I think it's just not a fast enough mode of communication. But text and email text and phone are going to be the mainstays of communication that we use.
Will my cat be in pain after surgery?
Well, if I've done my job right, hopefully not. So we do a lot of pain control. We do multimodal pain control, which means that they get pre-meds with pain meds. They get intra-op meds like a local block, an incisional block with local like lidocaine or bupivacaine, like long-acting incisional blocks. We do cold laser after to reduce pain, inflammation, and speed healing. On like big incisions, we'll also do cold packing. They get post-op pain injections. They get oral meds to go home. So is there going to be some discomfort? Yes. Do I want it to be pain? No. Like I want their pain scale to be like a 1 or a 2. Anything above that's not acceptable. All right, guys, I hope this helped answer some questions that you might have about CAT surgery. If you do have any other questions, please feel free to give us a call.